You just hit that fancy play button to get your front row seat to Pittsburgh's technology and innovation ecosystem. I'm Jonathan Kirsten with the Pittsburgh Technology Council and TechVibe Radio. And in today's episode, I am interviewing the dynamic duo behind Admirra. I'm talking about Wendy McSparren and John Mihalik, who are the co-founders of Admirra. And today, they're going to discuss their SaaS platform designed to help small to mid-sized mental health practices streamline their operations. Wendy shares her background as a licensed clinical social worker and the inspiration behind Admirra, born out of her own struggles during the pandemic to schedule patients. John, her husband, is the CTO and talks about the technical challenges and solutions they have developed along the way. If you keep on listening, you're going to learn how they highlight key features of their product, such as onboarding clients quickly, the business intelligence behind it, and all the automation it provides therapists. The duo also touch on their growth journey, including an acquisition and their plans for future expansion. Keep on listening to this deep dive into how technology can solve real-world mental health access issues and the inspiring entrepreneurial journey of building a startup that positively impacts people's lives. Let's jump into my conversation with Wendy and John right now. I am so happy to have you both here hanging out with me in the Huntington Bank studios, where I literally have the best conversations with the companies that are just making Pittsburgh tick. So guys, thanks for being here. And I'm very looking forward to catching up with you because it's been about a year. And a lot has happened.
A lot has happened, yeah.
Good things, too. Even better yet, they've been good.
That's
right. Fantastic. Before we jump into it, just let our listeners know who's who and what's what. Wendy, let's start with you.
I'm Wendy McSparren. I am co-founder and CEO of Admirra, which is a SaaS platform for mental health practices.
Yeah.
John Mihalik. I'm CTO of Admirra, so everything technical.
Everything technical. You make it sound so simple.
No, that's
awesome.
not so hard, actually, nowadays. Man.
Yeah, no, it's good stuff. And it's been really a great story to see how you bootstrap this thing. Just give me the quick elevator pitch in case someone is new to the story. They can just get the quick understanding of what Admirra is about. I really love the problem that you're solving because in this day and age, access to mental health is huge.
Yeah.
And for the folks that provide those services, being able to schedule appointments and manage their records and all that kind of stuff is just so important because it makes them become better therapists and healthcare providers and so forth.
Yeah, that's right. So we really fill the void of being able to help small to mid-sized mental health practices onboard and bring on clients and get them connected quickly with a clinician. And we also help with a lot of business intelligence to help these practices make good decisions about money that they're putting into marketing or resources.
Okay, yeah.
There's a number of workflows. So we're really a CRM for mental health practices with a whole bunch of operational bells and whistles that help them run their business in an automated way, more efficiently.
Totally.
So that's really what we're serving.
Yeah. And the inspiration for this, I mean, you have obviously a background in this. Tell us about a little bit of the formation story and how you solved this problem and you wanted to create a solution and then you got your guy here that can do the technical side of things. I always think that's so cool. I love that.
It is a good story.
Yeah.
It really is.
So I am a licensed clinical social worker. I've been a mental health therapist I'm entering into my 37th year, which is a little scary.
That's crazy,
scary
man.
to think
That's
about.
awesome. I love hearing that. That's impressive.
I have been doing this a long time. I was 23 when I graduated and have been working with kids, families, adults, my whole professional career. And when the pandemic happened, I was not able to see people in my office. So I started doing telehealth from home. And John is my husband, and we were working from home the entire time, and he was watching me really struggle to manage when I was getting phone calls or emails asking for sessions and how I was keeping track of all
the organizational stuff, right?
Yeah.
All of that, and not letting people fall through the cracks, but people were falling through the cracks. Verifying their insurance so they knew what they were going to have to pay out of pocket.
Okay.
Getting them connected. And I could only do so much as a solo practitioner. And he was watching me struggle.
Taking
and
notes. He's like, I got an idea.
He said, I really think you need to scale to a group practice. And I was like, I don't know that I want to do that.
Okay.
But you looked at me and said, you're not scalable.
I mean, one person can only do so much no matter what. But, she had so much experience in this game, and she went transformed really from a hands-on doer, and she still does. You still see patients, which is still great. But from that, just transitioning to a brand new business where you're managing lots of other therapists, it was a very different paradigm and a very different big shift for us.
Yeah.
But that exposed a lot of other issues, and the problems of losing people and managing intake
100%,
just accelerated like crazy.
I mean, through the pandemic,
Now
that
it was
then
even more.
it became even heightened.
Yeah,
at
so we
that
didn't
point.
solve the problem per se,
Start managing it
other
a
than
little
just
bit.
have more scale.
Right.
And the problems were still there, and that's what really sparked a lot of our development, which,
Yeah, and the thing is, a lot of tech companies around mental health will start to develop things that can help the patient directly, the client
Right.
directly.
Yeah, it makes sense.
There's
Right.
not a ton of development for the provider.
Okay.
And providers, small to mid-sized mental health practices, and honestly, even large-scale systems that provide mental health. I mean, I've worked in all of those in the area.
Not so good. Yeah, lacking
They
in many areas.
also have these bottlenecks and issues and don't have great solutions for them.
I'm curious, what is the market size for that you're addressing when it comes to the smaller providers? I'm sure there's got to be lots of them out there.
There are all
Yes.
over the United States and in their communities. And because they're trusted by their communities,
100%.
people refer to them. And it's really hard to keep up with the referral flow and track it. And so many people are using spreadsheets, and you get to a certain volume and that no longer works.
Exactly.
And you go cross-eyed looking at spreadsheets trying to make sense. And you still don't have the business intelligence to understand unless you're really skillful at writing code for those spreadsheets, which John was able to do that for me as a group practice owner. But again, we got to a certain volume and scale that we were still blind to things.
Yeah, we did a lot of work to set up your own personal practice, and then your friends and other people, her acquaintances that actually had their own group practice, said, "Oh, can you do that for us?" And we're like, "Yeah, but now I'm not scalable. I'm only one person. I can only do so much."
That's when it made sense that you could actually build something that someone could literally turn on, they could log into, and then have access to a system.
And that was when, let's create software. So let's build a platform that can be scalable, because, again, it was really hard to do that. So that's where we just jumped in and said, okay, so let's build a platform. And then we rolled that out to a few personal friends. And
colleagues,
they
tested
pressure
it.
tested it. And then we had all of the back-end platform and everything we had to build to be HIPAA compliant and secure and blah. I mean, it's really complicated stuff.
Especially the HIPAA stuff.
Kind of get into it, yeah.
All the regulatory stuff.
Yeah, all the stuff.
Yeah.
So
we learned a lot, and just with feedback. And what I love about the way we work now, even, and this is even from our starting process, it really was iterative. I didn't go away and say, okay, let's envision this giant platform, and then let's just build it. If you do that, you're almost certainly going to be wrong. So we just evolved it as problems came in. We solved the micro problems one by one. And we've been doing that for a year and a half.
Oh, more than that.
A
My
little
God,
bit, yeah.
Since 2022.
Yeah, coming from a
You're
little
4 years into this,
spreadsheet, it's
right?
evolved
Yeah,
into millions of lines of code. But it's just been that iterative kind of flow. Which
So as you built this and started to actually harden it and realize that this is something that we can then sell to people, at some point then you're like, wait a second, how do we actually get this thing out there? How do we start making money on this?
That's right.
And I think when the pivotal parts was joining up with IW and Alpha Lab to kind of help guide you to that next level, which is where I talked to you last time as you guys were just kind of coming up and through that. And it was looking like, wow, what we have works. People are using it. And you're getting new customers that were kind of glomming onto it. And then a year has gone by now, and I get excited because I know so much has happened.
A lot has happened.
Which to me, I love watching a company grow like this. To me, it's just very exciting. And especially when you're solving a really important problem here. I feel like I love it when you're being able to bring something to market that's, wow, it's going to help someone out. From the therapist that needs help managing everything to the patient knowing, what am I going to have to pay? Can I get my appointment? And the fact that if you can get someone, make that you can make that conversation happen with them faster. They can get connected faster. That means that patient's getting help quicker, and they can find some relief in their life. I don't know. It works on many different levels.
Yeah,
I think it's super cool.
Access has always been an issue. I mean, my entire professional career, it's been an issue. The pandemic really shined a light on.
I always feel like that's one of the key nice takeaways from the pandemic was at least people realize how important mental health is, and that accessing it is not a bad thing, and that it's nothing to be ashamed of, and that we all need to be seeing a therapist as far as I'm concerned. And the idea that so I think that really brought that to the forefront, and which I think makes your software all the more important.
That's one of the things that we like when we have our conversations. I always tell I'm serial entrepreneur. I worked at a few other places before, and I've told Wendy, I just want a good problem to solve.
Okay.
And we could talk about a good problem, and then everything comes out, is it a product market? How big is the market?
Exactly.
All that fun stuff and good questions. However, what was so unique about this was all those were yes, but then at the end of the day, it was, are you actually helping people? And that was a solid yes. 100%. So it was like, that actually is a really good problem to solve, and that really just makes me feel good because now I'm writing software. I'm not writing bid optimization software, blah, 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 like I'm used to, if you will. And there's nothing wrong with that. But I feel like
it's going for a better cause.
It makes a difference. It makes an actual difference.
Yeah, I would agree with you. Yeah, that's one of the things I just love. We have so many of our member companies at the Tech Council that are building products that just they really solve an interesting problem. It's more than just I can now order pizza on my phone or something. Right. Great, I like that. But the idea that it makes someone's life better, it alleviates some pain, some suffering. I think they get an extra little something from me. Yeah. I don't know what that is, but a little more respect, I guess, just because I like it when people are being helped. Yeah. And I love seeing technology help people. And also I see people like you taking the risk to do this. I mean, this is not an easy road to take when you're doing this. I mean, it's not, candy and sunshine every day. It's tough work, and you have jobs. The last time I checked, you're a therapist, right? And
I still have my group practice. Exactly. We've gotten to a point that John has been able to
full-time
Admirra, so we've made that leap.
Which is a big jump for us.
That's a huge jump. I'd be like, oh my God.
Yeah, and last year I was able to hire a director of operations who's really managing my practice, and my office manager. They really have held down the fort.
Good.
And I mean, my practice really gives us a place to pressure test anything we're doing with Admirra.
I was going to say, you can literally, and you find new ideas that you can add to the platform and so forth. Yeah. So this past year, I mean, what is new? What has you most excited? I mean, customers, new features, like all the above. What's going on?
So last time we talked to you, we were doing a fellowship with Alpha Lab Innovation Works.
Yes.
And we were invited back in the spring, winter of 2025 for full participation. And we really started to grow customers. I think last time I was here, we might have had, 5, but by January of 2025, we had 20.
All right.
And then we actually did an acquisition of a mental health CRM, all of their customers. We joined forces with Practice Access, which was the first CRM. I think they were out a little bit ahead of us. And we found each other, and we started talking, and we decided to come together and join forces.
Probably makes sense to come together like that.
So
very cool.
Their CEO, Barrett Elizabeth, and John and I talked for months and figured out a way to make it happen. And those customers that were on that platform all migrated over to Admirra. And we had most of them migrated by summer, a handful in the fall who were larger practices with a little more nuance, complexity that we had to sort of work through.
Okay.
And so Barrett has now come on as our Chief Growth Officer, and we've absorbed that team from Practice Access. We have a VP of Product and support, Taryn Boley, and we have 2 support people, Leah and Will, and we have another part-time developer. So we've gone from John and I to a team of 7.
That's awesome.
I
mean, come on, that is freaking cool.
It is. And it's hard for us sometimes to take a step back and be like, look at what we've accomplished.
You've done
'Cause
a
there's
lot.
So much
well, you're living
that
in
we
the
still
middle
do.
of it.
There's
That's
always-
why we have these conversations, so you can stop and think about it, and I can say, yeah, that's pretty cool.
Yeah.
Simple as that. That's so cool.
We have
very
customers
impressed.
all over the United States now,
And I
all
love
over, and we're growing.
And nothing makes me happier
Yeah.
than someone saying they got customers, because I'm sorry, that's where the rubber meets the road.
That is.
I mean, you can have the best of ideas. So what? If no one's going to buy it,
That's right. That's right.
that's what it comes down to. You got to make money at
Right.
this. That's
Right.
what I'm talking
And
about.
you have to pressure test your solution. You don't know if it really works for everyone. I mean,
Exactly.
are we over engineering just for Wendy's practice? Or so we've learned so much.
What have you learned? A couple key takeaways. What would you see when the bigger things you've learned were like, oh my God, like we need to add this, or we didn't. I don't know. I'm just always curious, like, because something's always going to come up. And I don't mean to put you on the spot either, but
I think we've learned a lot. I mean, there's so much we've added to our platform here. And above all, like the first thing that, like one of the tenets that we try to do is keep it simple so that these folks can use it. Because there's a lot of like CRMs out there I've used before as well. You probably use CRMs here.
Yeah, we do.
No doubt. And you love to hate them too.
very
right?
intuitive.
You
Very
know? I mean,
intuitive, yeah.
Absolutely not.
It's like it reads my mind every time I go in and just get stuff done.
That's
yes.
right. So we learned that with a really don't go and do everything, but just really fine tune and pick the things that really truly matter and make it simple to use. You really shouldn't have to go into a manual and figure this out. Anyone should be able to log in, do it, just start using it.
Exactly.
So that was one of the things we learned,
Okay.
that it comes pre-built out of the
Pre-built,
box.
ready to go. Yeah,
It's not
exactly.
just a tool, it's a solution. It's got everything ready to go for you, email templates, you name it, all of that.
Automations that are preset
Automations,
to help
everything's-
things just
boom.
happen.
Yeah.
That you can decide if that fits your workflow
Yeah.
and automate so much of it and centralize all of your communication in one platform for your whole admin team. It's interesting because we have electronic health records or EMRs, electronic medical records, but there's so much of this that the electronic health records don't do. So we sit in front of it and we sit on the back end of it for a lot of the business operations. And that client flow into your practice is so important. And then some of the back end things that we do in terms of workflows to help you manage some of your billing issues if claims are denied or if copays are outstanding, and how to keep track of all of that stuff to keep your business viable and sustainable. And so many practices fly blind and are overwhelmed and just doing the best they can. With all these business operations, and we're not trained to do business.
No,
in
you're
school.
there to listen to people and help them through their problems,
right.
not
That's
be
right.
able to be like, looking at my spreadsheet properly.
I know, yeah.
And I loved it. Everything, when we rolled out all these, like we have workflows and all of that, it all comes pre-built with the experience that Wendy and the team and other practices that we talk to and get feedback on provide.
Yeah.
So it's pre-built. It's kind of like, this is the way you should do psychological testing scenarios. When folks are coming in looking for that kind of a service, you have this stage, talk to them about this, do insurance benefit checks at this point, not before. All of that fun stuff is kind of all built in, and it can be tuned and changed.
Yes.
But you don't just have a blank sheet of paper in front of you.
Yeah,
Most tools will give you.
I love the idea that it's pre-built and it already has these scenarios set into it, which actually makes you better because maybe you weren't following those
That's right.
procedures. And you learned that there's a better way to be doing this, and it's, oh my goodness.
That's
So I'm assuming, like, wow, that's just so cool.
And that's been our key differentiator by far, is you could get a really great CRM. There's so many out there in the Salesforce, the HubSpots, you name it. You can go those routes, and they're really great products.
Then what? How do you set
But
it
then they're
up?
blank
Right.
sheets of paper
Exactly.
too, and you have to set it up, and you have to actually figure out how to use it. And some of them, and I'm a software engineer, some of them are so hard and complicated to use and easy to misconfigure. So I think that's been a big differentiator, and that's brought a lot more on. We've done very little marketing yet.
Still haven't.
But we pressure tested this. Now we're closing in on 100 customers. And now we're really about to turn the flow on, I think, this year. And we're looking for, hopefully, significant growth.
Yeah. So what's your plan for growth for this year? I feel like you've set this awesome base now, right? And so now it's just, let's move into this mode of really going into customer acquisition, I guess, right?
Yeah,
That's
and
right.
that's
exactly right.
John has much more experience in that in the startup world than I do. I mean,
Sure.
I've
That's why I'm glad you guys are a team.
I
think
know.
this is
It does
cool.
work
I,
out
I
really
feel like
well.
you each bring this different thing to the table
really do.
that one person could never really fully do. So I'm glad you guys are like hanging out.
Yeah, it's a good thing. It's been a good marriage. It's been a good business relationship. It has been really good, and we balance each other out, I think,
We really do.
very well.
We were concerned about it when we were starting this up originally. It was like, because we're kind of type A's, if you will, and how are we going to work together? How is that
We're
going
both
to...
I'd be
used to being in
terrified.
Is that
charge.
yeah, they're
We're
going to
both-
ruin our relationship.
Yeah.
But like we were concerned, like we're going to work together. It's a very different thing.
Yeah.
But it's
been working.
I
Yeah.
mean, we work fantastically.
I'm glad to hear that.
I think
definitely.
we know.
That would be tricky
And
for a lot
Wendy
of
is
couples.
definitely the leader of the company, and she's very gifted at that. She's the CEO. She runs it. She has it's ultimate decision maker for sure, and she really builds the background of why we're doing this, and she has all the experience with the healthcare industry that just flows into everything we do from a product perspective.
That makes me happy
Yeah.
to hear that, because I mean it'd be really tricky for couples to work together. I mean, who's the boss? I mean, luckily, like you got the therapist background, so
yeah.
you understand dynamics and things like that. But still, I mean, I think you can only like be a therapist to yourself so deep before
Yeah.
it's like, hey, this guy's driving me nuts. Why does he chew so loud when he's eating those ham sandwiches?
I know, exactly. That's so funny. Yeah, it's interesting because we really defer to each other's strengths. And again,
great.
John has a ton of experience in SaaS startup, marketing specifically. Those platforms were very marketing focused. I've never had to market as a clinician. I've really just, my reputation, my relationships, it's always
It's not part of the business, right? Exactly.
It's just worked. I've always had more than I can handle referrals So I'm learning a little bit more about that piece of it, but I want that kind of marketing for a SaaS product to also have a certain culture and ethics to it that's really important.
Definitely.
Absolutely.
I mean, we want to be successful. We want this to grow big. We want everyone to be able to prosper from it, but we want it to be in a way that it has kindness and ethics and
I love hearing that. That's-
grounded in that.
God forbid. I mean,
Right.
it's like, my goodness. Yeah, I mean, things can be so cutthroat sometimes, and I get it, business.
Definitely.
But I like business and capitalism with a softer edge to it sometimes.
Yeah. I'm excited because I think we've really found a way. Like we've never lost sight of mental health accessibility.
Maybe it's been really key to your success is being able to be grounded in that
Absolutely.
it can kind of keep you
Definitely.
focused
That's
towards
right.
that's
That's
what
right.
the end goal is, so it keeps you there.
And there's a capitalism side of this and the other side of just helping people. And,
Surely.
And those things sometimes are at odds, but I think we've
But they
found
can live together, too.
a good
Yeah, they
place
sure
where
can.
they can. And what we're trying to do is help these smaller mental health practices all over the world and the United States, obviously, to be profitable, to be sustainable. If they can be sustainable, they're going to help other folks get mental
That's what I was
access.
saying in the beginning.
So
the idea is that
it's just-
it works on so many levels like that.
Yeah.
I think it's amazing. So if we're talking next year at this time, where would you hope you'd be? What kind of news would you like to be reporting to me saying, my God, Jonathan, I can't believe it, but we did this and this?
That's a good question.
And you can think big. It's
mean,
all cool. We're not going to hold you to it. But I just want to. I'm always curious. What would if I were to think? I know I'd like to see you guys. Be maybe tell me what you think if I were to answer this question.
That's
for
interesting.
You. Okay. So I'm gonna let me think about how I would do this. I would say that. So you're at 200 customers right now.
No, approaching 100.
100.
I mean,
Yeah,
100.
yeah,
Okay, yeah. So I would say if you come back, because I feel like when you get that 100 base and you start trucking on this thing, right?
Yeah.
I would say, and I'm thinking, you come back next year, it's time, you're going to be like, my God, we just hit our 250th customer. But we also have a large health system that sees interest
Interesting.
in this concept and how it could maybe be deployed or scaled at some other types of practices or something like that. And we just hired like our 12th employee to help because we had to add 2 people to the sales team. Am I too far off base?
Well,
I love answering
so
questions for my guests.
I know, I
I'm
appreciate
so good
that.
at it. Yeah.
I will tell you, I think
a good
if we come
scenario.
back this next year, I think we'll have over 1,000 customers.
Oh my God.
I think we will
think
have
so,
a plan and be expanding into Canada.
Oh wow.
And I think we will be talking about and dreaming about other verticals.
I like your
realized,
answer better than my answer.
I think we really. I mean,
I think you like my answer better. John, take the pressure off me.
Oh, it's all good. I love it. No, we're actually turning, like, from a technology perspective, it's less about adding features and functionality.
Yeah, it's getting it out there.
Not that is ever going away,
No.
never, but it's really all about scalability and making sure that we can have an infinite growth path architecturally. So that's what we're turning a lot of our attention into, is to do that such that we can support the customer acquisition kind of growth here, which is really where we're turning our attention to.
For
So
2026.
I feel like we have this pressure tested. It's really about growing right now.
Okay.
And I think we're both, I think 1,000 is absolutely
Completely doable and
100%.
might be more.
Yeah.
I like where you're going. You keep up on the number here. This is great.
I mean,
Well,
it's a highly optimistic, perhaps.
That's all good. No,
But I
you got to
think
set
it's
some numbers because, I mean, you got to think it
doable.
to make it materialize. That's how I always look at it. So that's awesome.
We really have done very little reach out to any outbound. It's all just been inbound and whether or not they find us or not.
Yeah, I feel like there's a little bit. There could be a little bit of a snowball effect on some of it. Where when you get certain numbers of customers, they're in the other circles, and I just feel like it starts to kind of grow
That's
like
right.
that.
I mean, we're a tight community as clinicians, even though we're all over the United States. And
that makes sense.
I mean, as clinicians, I mean, there's like 1.8 million licensed professionals in mental health in the United States.
Okay.
We want to learn from each other. We go to conferences. The word of mouth, the recommendation from somebody holds a lot of weight. When we're talking, we listen to each other because we're all in this kind of digging around and doing the same thing and trying to help people.
I love it.
Yeah, we found there is no solution out there. What we have, there really isn't. I mean, you could get your own standalone CRM, if you will, but you're going to get a blank sheet of paper.
I would love to buy a Salesforce license right now and just start building away. See what I can do for myself.
I love Salesforce.
Yeah, no, me
I've
too.
used it. I've programmed to it.
100%. But I'm just saying, if I'm somebody who's running my own practice and I have a bunch of patients that I'm helping out, I'm like, I'm not spending my time setting up my own CRM. I want something that's ready to go.
So we feel the market's wide open. So, now it's just about growth.
Yeah, that's great. I'm excited about the growth.
I'm excited.
At the Tech Council, we're very excited for you guys. We love seeing our members get to this part where it's, we've gone through all this, and now it's time to, let's get that 1,000 customers.
Yeah.
So 1,000 customers.
That's right.
That's my key takeaway, Wendy.
I love it, John.
You guys are awesome, man. So much fun.
No pressure.
Pressure. So just remember, don't disappoint me.
It's a goal.
It is a goal.
Yeah, I love it, guys. Thank you for hanging out with me. I love getting the update. I know I've learned so much about where you guys are heading on this, and I'm excited.
Yeah, thank you for having us.
Thank you. We really appreciate you.
100%.
The whole community in Pittsburgh is really just so supportive.
And the Tech Council has been great.
feels so
Keep talking.
Y'all
I'm kidding.
have been fantastic for us.
No, it's just what we're in business for. We just want to be able to be helpful wherever and however we can that can help you get to whatever level you're trying to get to. And
it's so appreciated. Really.
Yeah.
It's so needed. It's so hard to build a company.
I can't imagine.
Really hard. And
Don, I've been watching guys and women like you build companies for almost 30 years now. I don't have the stomach for it. I just don't. God bless it. I just no. It's crazy.
It's a lot.
I'm glad people do it because that's how stuff gets done. But I'm not. That's not my mindset.
And I thought we would be at this point in our careers because we're not early in our careers.
Yeah. We just kind of fell into it, and we said, look, if not us, why not? Right? I mean, it was an opportunity. So
I'm glad you took it.
Yeah.
Running with it and building something out of it. So
that's the idea.
Great stuff. Appreciate you guys stopping by.
Thank you.
Definitely making Pittsburgh proud all the way through. And I'll leave it at that. Hey, if you want more great stories like this, just keep following us here on TechVibe. It's been Jonathan and Kirsten with the Pittsburgh Technology Council and TechVibe, and I look forward to seeing you on the next one.